solium, firstly, can you see both of them? This also has 4 suckers and this also has 4 suckers. All of them have 4 suckers. But out of Taenia, saginata and solium, who will not have hooklets? So you will say saginata mein ma'am tata to the hooklets. There are not gonna be any hooklets that you are gonna see. There are no hooklets. I don't see anything on the top. Whereas in Taenia solium, can you see? In Taenia solium, how many rows of hooklets are there? 2 rows of hooklets are there. Now the stories become easy, na? So tata mein tata kar dena. There are no hooklets. Now, abhi the story is very simple. Now what I'm going to show you, you would want to run away and you will say, ma'am, we want to disown your lectures now. Because this is one of the most troublesome table which every second year student, every NEET PG, FMG aspirant comes to me with, that ma'am, what has happened in this table? Trust me, you don't have to learn it the way you are looking at it. Try to look at the way I will look at this table and I promise this is going to be the easiest table. Ab isme kya karna? Look at the lengthy name. Taenia saginata. Saginata is lengthier, na? Solium is chota na. So anything numerical I ask you, how much number, everything in number will be more in the Taenia saginata. So if they ask you that in the worms, that's why I did not split it into multiple table, because you don't have to read it only like this. Chota chota padna hai. Please remember, they ask you who is lengthier. You can see 5 to 10 meters is saginata, solium is chota. So who is lengthier? Saginata is going to be lengthier. Okay, look at the head end. Who has a larger head? Saginata has a larger head. Who has a pigmented head? Saginata has a pigmented head. Who has a longer neck? Saginata has a longer egg. Who has more proglottids? 1000 to 2000, more in number? Saginata. Who is going to have a larger gravid segment? Saginata. Who is going to have more uterine branches? 15 to 30? Saginata. Who has a vagina? Again, saginata. Who is going to have more follicles in the testes? Saginata. Is this a tough table? Because you don't have to learn the numbers. You just have to make sure that you know that everything in excess that is happening, be it the length or the size of the scolex, the neck ka size, proglottids ka, uterine branches, vagina ka size, presence or testicular follicles, everything is more in saginata. But you'll say that, ma'am, if I have an MCQ and they say that pick up the most important, so proglottids and uterine branches, number nahi yaad karna. Just know that to differentiate between Taenia saginata versus Taenia solium, we always prefer to take up this number 1 proglottid wala story and this number 2 uterine branches wala story. This is something, but yeah, you know what is more. Saginata is always going to be more, right? Okay, this was about ठीक है, saginata में everything is going to be more. Only one thing you have done tata to, and that tata to that you have done is going to be that there are no hooklets. Tata to the hooklets करा था, बाकी everything is going to be more. Now let's come to the real deal. This was the bad table. Now let's come down to host. Host तो पता है ma'am, we already know. The definitive host of everything is going to be humans, but the intermediate host is different, na? Taenia saginata, it has ta, so cata, cattle. Cattle is going to be for saginata and pigs are going to be for solium. Okay? Cattle, saginata and pigs are going to be solium. Okay, so I've understood. Now you'll say that every organism has two things. It has a larva and it has an egg. So what is the name of their larva? So dekho, cattle and all this, cattle, cows, this reminds me of bovine. Cattle, cows, bovine hota hai na? So remember Cysticercus bovis, you will say, okay ma'am, bovis matlab bovine. This is present in the cow. This is present in the cattle. This is present in the cow. This is not in me. Iske naam mein hi hai. This is present in the cattle only. Whereas Cysticercus cellulose, it has so many S's wala sound. Cysticercus cellulose, sab mein this larva is present. It's going to be present in the pigs also. It's going to be present in the humans also. That's just ways of learning that I'm telling you. Otherwise, your mind goes into such a frenzy and you can never learn anything. So remember, Cysticercus bovis will always remind you of cattle. Ye only cattle mein hai. Only in cattle, not in man. Taenia solium, sab mein, solium sab mein, Cysticercus cellulose, sab mein, pigs may be, man may be. Okay, so now you will ask me that what is the disease that they will cause? So remember the larva over here in humans. I want to know what it causes in us. It only causes intestinal infection. It is only going to cause intestinal infection. But Taenia solium, sab kuch, everything is sab kuch. So not only will it cause an intestinal infection, but it will also cause cysticercosis. Guys, I'm sure you've heard of neurocysticercosis. So basically other organ involvements are also occurring. Why ma'am? ऐसा क्यों है? both of them are Taenias, both of them are causing intestinal infection. Why is this solium causing सब कुछ? Because solium का egg is also infective to us. The eggs that we will produce from these larvae and adults, these eggs are also infective to us. Whereas for saginata, the eggs are not infective to us. So when the eggs are not infective, you will not have other organ involvements. When the eggs are going to be infective to us, that is when the organ involvement is going to occur. So please remember, for the other organs to be involved, why did I write organ with a big anda over there? For the other organs to be involved, I need an anda. That is, I need an egg. And the egg being infective to man, सब कुछ infective तो सिर्फ solium का हो सकता है. Everything. Now I'll tell you the सब कुछ story. This is gonna have cysticercus cellulose. That is the larva which is present in some people. It is present in pig also. It is present in man also. It is gonna cause intestinal disease also. It is gonna cause cysticercosis in the organs also. Iska larva is also gonna be infective to us. Iska egg is also gonna be infective to us. सब कुछ yes करना when it comes to the disease of Taenia solium. So God balances na. When everything in numerical numbers was given more to saginata, everything in disease etiology is given to solium. God has a way of balancing things out. So now it's time for a test. You can see 1, 2, 3, 4. Definitely this is a cystode because I can see 4 suckers on the head end. And now if I say, is this Taenia saginata or solium? Of course you will say, ma'am, saginata hota to tata to the hooklets. But I can definitely see hooklets over here. So this is not Taenia saginata. This is going to be Taenia solium. Sorted? Should we see the life cycle once? And now the life cycle is simple. So you have clubbed both the life cycles. There is a human being. If it's human being with cattle, you will call saginata. If it is human being with pig, you will call it solium. So both the life cycles are the same, only minor changes you will see. Saginata with cattle and Taenia solium is going to be with pigs. So now you will ask me that, fine ma'am, I can see the adult worms also. Let's see what am I going to consume. So either I have consumed undercooked meat from either of these animals. I have consumed undercooked meat from either of these animals. I am going to get this organism. It is going to develop into adult male, male female hoga, eggs banenge. Eggs you already know. If it is a cystode, how is the egg going to look like? How many hooklets hoga? To hexacanth egg banega. We know all of that story. Ma'am, with that hexacanth embryo or with that hexacanth egg, now it is going to come out in the environment. Who is going to eat all those infected things? Either the cattle will eat it or the pig will eat it. Right? And that will go and settle into the muscle of this pig or whatever, pig or cattle jo bhi hai, uske muscle mein jaake those oncospheres are going to develop. They are going to develop into cysticerci. Cysticerci means larva. Common sense, na? If the egg had come out, the egg ultimately has to come out into a larva form. And now tell me, if you are dealing with, say, Taenia saginata, cattle wala, so what is the name of the larva? Cysticercus cellulose or Cysticercus bovis? Ma'am, cattle ke sath bovis hoga. And if you're talking about Taenia solium, then what are you going to call it? Sab kuch. So cellulose is going to be the name of the larva. And now that depends, what do we eat? Whether we get cattle or we eat pig, we are going to get the infection. So now, as I told you, there are two forms. Either there is intestinal or there is cysticercosis, all of the organisms. So now you know that intestinal to dono se hota hai. Taenia solium also causes it. Taenia saginata also causes it. So it is because of the larval form. That is what I was telling you. Larval form means either it is Cysticercus bovis or it is going to be Cysticercus cellulose, right? Cysticercus cellulose. So what is the definitive host? Of course, man. Intermediate host depend karta hai. It can be pig also, it can be cattle also. So that depends. But when all this story I knew, ma'am. But when I'm talking about organs, different organs, ma'am, the organ is gonna be with O, so you have to take help of the anda. This is due to the egg, and the egg of whom? The egg of sab kuch, that is Taenia solium. And in that case, man is only the definitive host, man is only the intermediate host, man hi sab kuch hoga. So please note that. Repeating it once again, when you're dealing with this cysticercosis, and I'm going to tell you different types of cysticercosis and how organs are affected, you will realize this organ involvement is happening only because of the anda, and this is happening only within man. This is not something happening in the animals. So now when I say cysticercosis, you will say, how ma'am, it is happening only because of andas? Yes. So what will happen? The eggs go into the GI GIT. I'll take you back to the life cycle. See, where did you see the adult worms? Can you see the adult worms over here in the small intestine? Imagine they laid down eggs. Where are eggs supposed to move out? Eggs are supposed to move out in the stool, but eggs decided we will penetrate into the GI tract. We will penetrate into the GI tract and then go to different organs, CNS, muscle, eye, so on. And if it goes to CNS, I call it neurocysticercosis. We all know that the most common site is going to be the brain parenchyma, and the most common presentation is seizures, most common. But different segments of the brain can be affected. Na? Dekho, if it goes into the parenchyma, I agree with you that the patient is going to have seizures. If it goes into the ventricles, I think the patient is going to have hydrocephalus. Of course, it can go into the subarachnoid space. It can go into the spinal cord. So different properties are known. If it goes into subarachnoid space, matlab meninges mein chala gaya. So it can go to different parts of the brain, which I don't want you to learn. I just want you to learn that going into the parenchyma, that is why I said brain parenchyma, and causing seizures. This aspect is going to be the most common presentation. I hope everyone's understood how intestinal type and the neurocysticercosis type is going to be different. So now moving forward, how do you do the lab diagnosis? Of course, especially of intestinal, how are you going to do the lab diagnosis? You are going to do stool examination, because eggs mein to koi difference nahi hai, whether it is saginata, whether it is solium. All the eggs of the cystodes are going to look the same. They are going to have 6 hooklets. All the cystode eggs are going to be the 6 cystodes, so matlab 6 hexacan. They are going to look the same, right? And if you can't see the eggs, what are the concentration methods I taught you in the beginning of parasitology? There are formal ether sedimentation techniques that you can use. So ye to tha for the lab diagnosis of intestinal infection. But what do you do in the lab diagnosis of other situations? Cysticercosis, like for example neurocysticercosis hoga, ya fir neuro is just one organ, na? It can go into the muscle also, it can go into the eyes also, it can go into skin also. So there are so many different places it can go to. What are you going to do? You are going to do a biopsy. I'll share a very interesting case with you. So biopsy, you'll say, "Arey ma'am, pathology wala, pink and blue wala biopsy." Yes. So imagine someone comes to you with a skin nodule. How will cysticercosis look under the biopsy? So I'll tell you a very interesting story from one of my residency, where a patient came to us with multiple nodules all over the body. And when a person comes to you with multiple nodules all over the body, and you are a first year resident like I was, I basically thought, oh, multiple chota nodules on the head, scalp, everywhere he had. I was just out of NEET PG preparation. I thought, oh my God, this I have diagnosed as a case of neurofibromatosis. So then I started asking him more history. I said, do you have some pigmented spots? Maybe I thought I was bubbling with knowledge, na? Because I was just out of my entrance exam. So I was like, oh, cafe ole spots dhoonte hain. Let me see whether has he got ophthal examination done? Does he have leash nodules? I went deep down into neurofibromatosis. But one thing I was like, let me just find out, are these painful? I kept touching the nodules, palpating them, and he was comfortable. He said, no, there is no pain, but yeah, there are lots of nodules. Painful nahi tha. Ab neural tumor was not painful. I started doubting my diagnosis. I said, okay, let me just do what I have been told by my seniors. I was sent for FNSE. That day I was in the FNSE OPD. I said, okay, let me not put too much of mind into it. Let me put a needle, baad mein dekhenge. When we put a needle, nothing came out. There was some fluid, white fluid came out. We couldn't see anything under the microscope. Then I told my senior said, let's get a biopsy done. Let's get one nodule removed and let's see under the microscope what is going to happen. And under the microscope, this is what we saw. We saw that there was an organism with a head like this, which had these suckers over here. You can see those round suckers. And it had an extremely convoluted spiral canal. And it had a thin wall around it. This is the classical, ye jo suckers with this extremely convoluted fold. This is a classical case of cysticercosis. Remember, this is a classical cysticercosis. Remember this head with this spiral tail. This is what we found on a biopsy. Other than that, you can do an X-ray. If you're thinking the nodule is in some soft tissue muscle plane, you can do an X-ray. You can also do a CT scan. Maybe the parasite will get calcified, and you can also do an ELISA testing. What is the treatment? As I said, treatment for all coming out to be praziquantel. So the two most important things, Taenia saginata and solium, are done. Repeating once again that Taenia saginata. Please remember the most important points I'm highlighting over here. Taenia saginata has tata to the hooklets. It's not going to have any hooklets, but the worm is going to have all the features. I'm just going to write all the features because you know everything is more over here, right? Whereas if you compare it with Taenia solium, solium ko God has given all the clinical acumen. Solium ka God says that when you're talking about the larva, that is Cysticercus cellulose, it is going to be present in humans also, it is going to be present in pig also. This larva is going to cause intestinal disease also, and yes, later on when it gives rise to eggs, those eggs are going to cause anda wala, that is other organ involvement also. So sab kuch is going to happen over here, right? Whereas in Taenia saginata, just intestinal infection, that's it. Okay, now although you feel these are the only two Taenias on this planet, no, there is something known as Taenia saginata asiatica and Taenia multiceps. One line about it. When I say Taenia saginata, you start saying, "Arey, saginata matlab ma'am, there must be a human, and saginata means cattle." But if I add Asiatica word in front of it, that cattle is going to go away and the host is going to become a pig. Oh my God. This means Taenia saginata Asiatica is having the life cycle very similar to Taenia solium. Bas itna sa yaad rakhna hai, nothing else. So please note, everything is going like Taenia saginata. But if I say Asiatica, only thing that I've done is that cattle nahi karna, then go the solium bit. Okay? The next one is known as Taenia multiceps. Taenia multiceps to bilkul hi weird hai. You will realize that humans are not there in their life cycle also. So human has become an accidental host. The primary life cycle is happening between dog and sheep. The life cycle is happening animal. ये किसके जैसा लग रहा है? What I'm going to teach you next. This is sounding like the dog tapeworm. So, oh my God, this multiceps though has totally left the family only. Multiple direction mein chala gaya. Multiceps has gone in multifold direction. It is gonna be having a life cycle between the dog and the sheep, just similar to Echinococcus, dog tapeworm. Human has become an accidental host. That is all that I wanted to know. So, Taenia saginata is like saginata, but if you add Asiatica, it starts looking like solium. Taenia multiceps though has gone in multiple other directions. It has started behaving